Hello, everyone, and welcome back to another exciting version of Chip Talks Health. Today, we are lucky and privileged to be joined by Dr. Marion McNabb. So welcome, Dr. McNabb, to the show.
Thank you so much, Chip. I'm really excited to be here this morning.
Very excited to have you. And this is, I think, going to be a really important interview. Certainly, if you guys are out there, let's say, in the cannabis space or have watched the cannabis space, both in Oklahoma and nationally. Oklahoma is kind of an interesting place nationally when you look at the marijuana situation. And Oklahoma has also been beset upon by, let's say, poor statistical studies. So you have just recently done a study on the Oklahoma medical marijuana market. So that's awesome. We're going to dive in and talk about that in great detail. But before we do that, do you want to give us a little bit of background about your, background in cannabis, kind of what you've done, you as a public health official, and you as an Oklahoman? So I just found out you're a fifth generation Oklahoman. So let's talk about that.
I am. Thank you. Yeah, it's great to be here. So my name is Dr. Marion McNabb. I have a public health doctor by training and also have a master's degree in public health. Spent the first part of my career working in resource limited settings, actually, and working mainly in Africa and Haiti, and really got my chops in implementing public health training programs and research studies in resource poor settings, and really learning how to engage with digital health tools and really engage with communities in conducting research studies and public health programs. Back in 2017, I was born in Oklahoma. I lived here until I was 12. I am a fifth generation Okie. And as I grew up, I spent most of my first part of my career, as I mentioned, working in Africa. But then I moved to Massachusetts to complete my doctorate at Boston University School of Public Health. So I moved there in 2010 and proceeded to complete my doctorate while working in global public health, but also starting to realize that medical cannabis was becoming legal and more prevalent in the state. And then back in 2017, I graduated from my doctorate in public health. And that next year, in 2017, the adult use passed for medical adult use cannabis passed in Massachusetts. It became legalized. So at that time, I had already graduated with my doctorate. I was really, really curious about cannabis. I was a medical cannabis patient myself. Really in Massachusetts, when it became legal for adult use, I really saw an opportunity with over 120 different institutions of higher education in the state and the Commonwealth, and a really push towards advanced healthcare and research in Massachusetts with all of those academic institutions. And so I proceeded to set out to form a company called Cannabis Community Care and Research Network with the idea of bringing together academics, policymakers, researchers, patients, and the general public together to advance cannabis research and education. And that year, Boston University was a leader in the pack at the time, and the School of Business, the Questrom School of Business, hosted a cannabis startup competition for ancillary not plant touching businesses. The competition was funded by Green Lion Partners, which was a cannabis consulting company out of Colorado, and was open only for Boston University alumni, faculty, or students. And so at the time, my business partner and I competed in the competition, and our vision was to create a virtual cannabis center of excellence. So taking that concept of bringing together these communities, but doing that in a way of, virtually communicating, collaborating, but then also advancing research studies and then putting those policy findings into practice, or research findings into practice. So we ended up winning the Boston University Cannabis Startup Competition back in 2017. It feels like a decade ago almost now. And we won $10,000. And we used that funding to, under the advice of Boston University, to start educational events in Massachusetts. And we started to bring together all of those stakeholders that I talked about. And that raised the attention of some universities in Massachusetts, and one in particular, University of Massachusetts, Dartmouth. A professor there out of the School of Business reached out, and we, over time, created a formal arrangement between my nonprofit, the Cannabis Center of Excellence, and the University of Massachusetts, Dartmouth, with their institutional review board, so that we could conduct research studies with the cannabis industry, with real world evidence, with patients that were already using products that were out on the market, and have those studies approved by the institutional IRB, which allowed, strengthened academic credibility and collaboration with the research studies. So we started our first study as a cannabis consumer and a patient study, and we collected over 2,300 responses in our first study, really wanting to try a new approach where we were adapting public health research methods called citizen science methods that were implemented in environmental health. We wanted to apply these methods to the cannabis industry. What I mean by that is participatory research. So we engaged with patients to design the research study tools and instruments to make sure they were relevant. And then as we collected data, we made sure that those findings were fed back to the participants immediately, and then also used as part of our educational platforms in our events. And so we would invite policymakers and business owners and, researchers to discuss the findings and the implications of those findings, specifically in Massachusetts. So we started that in 2018 and expanded in 2019 to a veterans study, which is now published in the Journal of Clinical Therapeutics, the research findings. We collected over 400 responses from veterans and really started to see the differences between veteran populations that consume cannabis and the rationale and the reasons why they do versus civilian populations. And then fast forward 8 years, I was the principal investigator of 12 different research studies.
Oh, wow. Very good.
Yeah. Ended up looking, at healthcare providers and how they are really largely unaware about cannabis and the cannabinoid system. I've also looked into different state-specific programs, specifically Oklahoma now that I'm here. So I did all of that work over in Massachusetts and just moved to Oklahoma back in November last year.
Awesome. Well, first of all, glad to have you back. And, let's go. Let's do the same thing that you did in Boston or in, Massachusetts here in Oklahoma. And, I tilt at that windmill all the time. So I'd love to have your help. And, we're getting ready to have some hopefully political help. And, we're going to have a new governor, and that should help things, depending on who that governor is. But we make the right decision there, then we should, health and the type of subjects that we're talking about should be opened up. And, we should have a whole kind of governor's health plan, let's say, or something around that, I would hope. We'll see. But anyway, that it's an exciting time, let's say, to be bringing these ideas to Oklahoma. So let me ask you this, because this is always my conspiratorial bent. So where are you finding the most resistance? Where did you find the most resistance in Massachusetts? And where are you finding the most resistance here in Oklahoma to what you're trying to do? And what you're trying to do is really just kind of survey people and tell people, what their attitudes are and what their behaviors are, right? So that shouldn't be threatening to anyone. So where are you running into the most resistance, would you say?
Yeah, that's a great question. Well, back at the time in Massachusetts, there really wasn't a lot of resistance. There was a lot of appetite for advancing cannabis research. And so really what I've advocated for is kind of threefold. One is to advance cannabis research wherever that is, to advance evidence-based education within, institutions of higher education for clinical education, as well as like frontline workers, and then social justice. And so to advance righting the wrongs of the drug war. And so those are kind of the three main areas of my work. And there was not a lot of resistance in Massachusetts. Actually, Massachusetts is now the Cannabis Control Commission, as part of the work of advocacy, has a cannabis research license, and they themselves are trying to establish a Cannabis Center of Excellence within the commission, and have prolifically published. And actually the results of our 2019 veterans study was published in the Journal of Clinical Therapeutics, which was that special issue was overseen by the research director of the Massachusetts Cannabis Control Commission, Dr. Julie Johnson. So she's also, leading several other journal issues. So Massachusetts is really running a good mark now, I think, in the research category. And I'm proud of the work that I did there. I served on the Cannabis Advisory Board, nominated by the Treasurer of Massachusetts from 2021 to 2023. And that's where we dug into a lot of the research recommendations, but we also dug into a lot of the problems in the industry in Massachusetts, and some that are faced here and in this report was around lab testing. And so there was a lot of issues related to lab testing that we developed recommendations for. Now,
real quick, just to stop you there, because we're very like-minded on that. So so the problem to me seems to be standards, right? So everyone is on a different reference standard. And so if I can choose my own standard, I can get whatever result that I want, and I can support that, with my whole SOPs and everything. But would you not agree that we all need to be on the same reference standard for testing? And then that just cleans up a lot of this mess.
Yeah, I think that's one element of it. The lab testing problem is so complex. And actually next week, there's going to be CANRA, a big meeting of all the regulators that are coming in, and hopefully a lot of discussions around lab testing, because it's an issue in every state. And that is, go ahead. And standards are one of them, one of the pieces of it. I think potency testing and then inflation of the results is a huge issue. And then here in Oklahoma, I think, the pesticides that we are, is limited, that we're testing for. I think we need to expand those panels. That's one of the key findings in this report that we worked on here recently.
So let's get into that report a little bit, because you just mentioned CANRA, and so I really want to kind of compare and contrast, let's say, but CANRA, kind of in conjunction with the OMMA, produced they called it an oversupply report or something like that a couple of years ago about the Oklahoma market. Are you familiar with that report?
Absolutely. That's so it was authored, I think, by CP.
Sophist. Yeah, Dr. Sophist. Yes.
Yeah, and I'm not entirely sure if it was entirely associated with CANRA, but the OMA did contract out with a group to do a supply and demand study back in and was published back in 2022. And there was a lot of, I think, methodological flaws associated with that study, and we call that out in this report. I think back to your earlier question about what are some of the challenges that I've seen in Oklahoma. That when I moved to Oklahoma, one of the biggest challenges that I've seen is the what you pointed out at the beginning of this episode, which is the fact that there's data that's being used at the state level that is in a report, the Taxoma report, that is outdated. It's fear mongering. It's using methodologies that are not up to snuff and standards for public health reporting. Thank you for pulling it up here. So this report was published in 2025, but it really relies on that earlier studies report that we're talking about. This is a very detailed report that goes into youth, claiming youth increase in consumption by dramatic claims using outdated data that is not the state's gold standard here. And so there's also, there's a lot, we can see here, there's a lot of discussion about enforcement of illegal activity, and that's important. There is illegal activity in cannabis here in Oklahoma, and that does need to be addressed. However, there's a real need to ensure that the legal businesses are protected and not included as part of that over enforcement. As you can see on the screen, it is true that there have been increase in poison control calls as a result, and that is a public health problem and an emerging problem. And if you go ahead.
Yeah, go ahead. So it's, well, and I don't want to, just to me, this report is very similar to the CAN report, and it's very flawed, in its methodology and all of that. So this is your report. So let's walk through your report, or just, you might talk about kind of some of the misconceptions that were happening in the Texoma report, and also the I'm going to call it the CANRA report because I know where it came from, but you might not. But from the CANRA report and OMMA CANRA report, that you might want to talk about a little bit about kind of some of the things that they got wrong. Let's say maybe in that report from your perspective as a public health professional, and then how you've countered that in your report.
Yeah, absolutely. So when I moved here, and the governor is using this Texoma report as a narrative and is working with the legislature, and that is the primary narrative. And that is, to me, what was bothersome, is that, as we've been discussing, a lot of the Texoma report has inflated claims. It also is using outdated data. And it is really, from a perspective of policing and enforcement. But trying to use public health methods that are not clearly public health methods to make their rationale. So earlier this year, I reached out to several community groups and local businesses, local advocates, local researchers, local healthcare providers that are focused on cannabis, lab testing colleagues, compliance colleagues, legal colleagues. I reached out to them asking if they wanted to jointly launch 2 different research studies and prepare a report that would allow a balanced discussion at the legislature and within the state's market. So back on April 1st, we very rapidly came together, and now it's June 5th. So I'm very proud of the work that we've been able to pull together in the last couple of months. But we have come together and we put together 2 different research studies. One was, again, a patient study similar to the ones that we launched in Massachusetts. In Oklahoma, what the interesting part about this market is, it's the largest medical market per capita in the United States. We have over 311,000 medical marijuana patients. That's huge. And so also it's been an easier market to get into with lower barriers to entry because there's no need for qualifying conditions necessarily to get a medical card, which is great. And it's optional to write on, when you register for a card, what your actual diagnostic condition is. So at the state level, they really don't have a broad picture of what the patient population really looks like as a result.
And honestly, that is my fault. I wanted to create the open access situation more than I wanted to track conditions and outcomes when we first kicked all this off. But boy, do I wish I would have at least required that you put a condition in there, because that would have made your job easier. And it also would have made data tracking all this a lot easier. Like, are people getting better from their medical marijuana use? And we don't really know because we can't tie that back to a condition right now. So mistake on my part, but also hopefully,
I think it was not a mistake on your part. I think it was a really smart move on your part to be able to create an easy access market. And I think now there's an opportunity. I mean, there's always can be a rules change where you can change the form. And then I think there's an opportunity to really link within the actual healthcare system now. So looking at the other data, information, public health surveillance systems, I mean, key finding number 17 on this report is for OMA to develop a public health framework that would be able to track data and be able to link and share interoperable data with other systems, whether that is, a public enforcement system, or whether that's, maybe the prescription monitoring database, where we can look at opioid prescriptions, where other states are leading the way on that.
Yeah, and if you look at insurance, right? So will cannabis eventually be paid for by insurance? Yeah. 1,000%. I mean, if you don't, if you guys out there don't see that coming, well, that's coming. I mean, sorry if you don't agree with that, but it's coming. Okay.
Yeah.
So in order to do that, you have to create the same type structures that exist in the pharmaceutical industry and the insurance industry. You have to be able to communicate payer to payee and all that, right? Well, there's data standards in that industry. And so that's something that I'm working on now, is basically building that pipeline and building those data standards for when this all does turn up, we'll be able to act like a real boy and, play in the insurance system. So anyway, all those structures are coming. Again, back to kind of some of your points, it really, and not to go back to politics, but it really depends on who we get as the next governor, what
Yes.
we can do with OMMA, but boy, does OMMA have potential. And I'm sure you're seeing the same potential that I am as far as data acquisition, as far as public health, as far as its ability to be a centerpiece, to be an aggregate for all this public health data. You know, who should be tying pharmaceutical data to cannabinoid recovery data? Well, it should be the OMMA. I mean, they should be
Yeah.
driving all this. So, and they've got plenty of money.
Driving research around it too, and whether or not that's research partnerships. And
So-
one of the, so we launched the study, and coming to the insurance part, it's really important because what we did was we asked patients in Oklahoma, we collected about 188 responses in about a month and a half. And we asked patients what they're consuming cannabis for. Top reasons are anxiety, depression, followed by chronic and severe pain and arthritis. And we asked patients, are you consuming cannabis to reduce any type of unwanted substance or medication? And 59% of patients reported reducing some kind of prescription medication use. Now, out of those prescription medications, notably, they were number one, antidepressants, followed by muscle relaxants. Then narcotics and opioids at 22%. And all of that to say that if we're looking at medication reduction and substitution, then that has a huge play on insurance and coverage. If you're moving a patient off of a chronic pain medication and off of opioids, which can be a very costly venture, and using cannabis as a harm reduction method, that has a strong insurance implication. I mean, I think New York has moved towards showing that, at least in addressing the opioid epidemic, the role that it can play financially. So
I don't know, it's really interesting when this rolled out, and to me, it was almost like a God thing, is Oklahoma really restricted opiate sales and began to really crack down, let's say, on opiate prescriptions almost the same month that we rolled out the program. And it really helped people transition, off opiates and into medical cannabis. So it was kind of a blessing when all this hit here in Oklahoma.
Yeah. I mean, and that's coming through in our data. The other notable point for harm reduction is the amount of people that report trying to reduce alcohol, which was 28% of people. And so we're seeing, and then it's followed by tobacco, an additional 20% of people. So, while cannabis is a non-lethal alternative, it's just really important for our healthcare providers to really start to understand this now. And what we asked in the study was, patients in Oklahoma, are you disclosing your cannabis use now? It's medical here. Are we increasing the dialogue? Over 84%. 83% reported disclosing their medical cannabis use to their healthcare provider. However, only 49% said that they thought their healthcare provider supported their use, and 33% were untrue. So,
that's about right. I would say that's a little high, even. But go ahead.
I do too. I think it is a little high, but at least half of the patients just don't know, or they don't support their use. And 5% of patients reported being discontinued from medical care because of cannabis use. So I have, done, as I mentioned, research in the past, and, more than 90% of medical schools aren't teaching the endocannabinoid system, and our healthcare providers are largely really unaware. But I feel like now there's 300,000 patients here, 1 in 13 Oklahomans, that healthcare providers are forced to know, and forced to have to really learn to understand. I know that now, as OMA is requiring physicians certifying physicians to take CME credits, which is important, continuing medical education on cannabis, and have those courses be approved. But I think, obviously.
By the way, just not to interrupt you, but just where are they getting those courses from? Who's teaching those courses? Who's qualified at a PhD level to teach on the endocannabinoid system? No one. So it's really interesting. You can't go to the same credentialing and kind of It's just, this is new, so we don't have the big deep pool of PhD experts. There are no even master's level experts on the endocannabinoid system, because it's taught as medical cannabis at a master's level, but the endocannabinoid system is not taught at a master's or PhD level. And it is our master regulatory system. It's a master regulatory system for anything with a spine. So how insane is that? But anyway, sorry, I had to interject.
No,
That's what I do.
There's standards that need to be developed in education too, clinical competencies. I worked on a paper for clinical competencies in cannabinoids that was published last year. And I agree. I think now we have opportunity with Schedule III, and that now that universities will be, obviously much more open to conducting cannabis research studies and to doing educational programs. I think it is a real shame that, and continued stigma, particularly in the substance use academic and clinical community. I think that's the hardest community to really talk to in a balanced way about medical cannabis. And they're so well funded that and with all the opioid resettlement funding and going on in the United States, there's an opportunity. But
it's kind of why I ask you about resistance, because to me, big food and big pharma and big tobacco are kind of the obvious ones, but insurance is resisting, banking is resisting. And why? Because this threatens, let's say, very old and very well established institutions. Again, in what world would it be wrong to teach you about your master regulatory system? Well, that's been my windmill I've been tilting at for the last 10 years. And I'll tell you that, my gosh, do I get great I was a TEDx speaker, and they wouldn't even let my speech on Big TED.
Yeah.
Okay. And I didn't say anything controversial. So
that's horrible. They wouldn't let that go. I mean, from a resistance publications, from like being able to scientifically publish, it was very difficult. Journals won't accept. Many journals wouldn't accept publications and only publish things that were funded by the harms. And that's even proven scientifically. But we are seeing changes, and that is heartening. But for the resistance, I think the resistance in Oklahoma stems from the governor, and it's really sad, because I think we have a great opportunity in Schedule III here. We have so many patients, and that's really the impetus of doing these two research studies, gathering the community and preparing this report that we're looking at. So the other group that we did survey were businesses, and we asked what are some successes and challenges. And since the industry started here, it has gone from 9,000 cultivators down 77% now to 2,000 cultivators. Now, those 2,000 are left resilient businesses, and the other manufacturer, the processors, and resilient businesses going through so many different changes, different, new rule changes all the time. And it being a really
over-regulated more than oil and gas, but yes, continue.
And then put on things like moratoriums and really not given support, but been more authoritative and law enforcement focused, I guess. So that kind of showed
vilified.
Through.
Vilified would be a good word.
That's a great word, vilified. That's shown through a lot in the results of the business survey. And so there's a lot of resistance in just helping a sector of business in Oklahoma to survive that is providing tax money that is supporting the education sector when Oklahoma's last in the education sector. So I think there's short-sightedness in blocking some of this. I know that addressing the illegal grows is a priority, and I think everybody agrees that that's a priority. But really, I think the OMMA, we have a lot of recommendations in here related to, providing some supportive guidance to the industry, getting additional experts on the advisory council when the OMMA, the patient representative was just fired from the executive advisory council.
I know, come on.
And for asking questions about recalls, which is the number one thing at the OMMA. The first two words in the mission is public health. And because of controversial questions of recalls, that should not be controversial. And that is finding number, I believe, 15, that the recall process here in Oklahoma is a huge issue. And, that's putting patient safety at major risk when there's products on the shelves that have been identified as having contaminants and still going through the system to be sold.
So I noticed that and so there's some Oklahomans, and we might, unless they want to be named, but were really injured by some dispensary products, and they went and they're part of your ecosystem. So if you go to the web page, you'll see them. But they were injured by product, and they went to the OMMA. They did testing on their own. They brought all that to the OMMA about a particular processor, and the OMMA was very reluctant to get involved with that, to go, just inspect that processor, to really get to the bottom of that. Took a year, I think, if not longer, for that to happen. That is insanity. That's not what a public health, network or an arm should look like. And back to research and all that. I mean, I applied for a research license to use medical cannabis to look at type 2 diabetes. And I had a really good plan and protocol, which I submitted, and very tight, scientific, ready to go study. And I still haven't gotten any ruling on that. That was submitted 2 years ago. But anyway, it's just, the failures are just ad nauseum. What do you, and again, if you were running that agency, how would you do it? If I was running that agency, how would I do it? Well, that's really how we need to be thinking, because this is a service. If I'm a governor, man, I look at this as a bright, shining star for Oklahoma. We're just rescheduling cannabis. We've got all this opportunity. Let's get all them companies here. Let's do that research here, right? Why in the world are we, because this is coming. It's coming. It's coming.
Yeah, it's not going away. And about the patient that you're speaking about, I'm happy to share that she's a co-author on this report, and that's Summer Parker and Patients for Safe Access. And it's a real shame that, it's taken years for OMA to really understand, and is flawed in so many different ways, and public health. And a key finding 17 of our report is really recommendations on what a public health framework should look like. They should develop a strategic plan around this. They did hire a new recall expert, so there's hope there in that category. And
again, everything's going to turn over in January, right?
Yeah.
Which is good. That's kind of what we want to have happen. So people like you and me need to get involved in that turnover, because they need, in public health, you go to your tried and trues, right? So you go to your PhDs and your, whoever, MDs, or whoever you're looking for your tried and true public health rulings. Well, this is different. This is different. And the people that are making decisions are not listening to the experts, right? And so that's a problem. That's a big problem.
And it's a really big problem. Education around evidence-based policymaking and informed policymaking is extraordinarily important, because cannabis is so dynamic, and you learn something every day, even if you've been in the industry for, years. And as a policymaker, it's extraordinarily important to have to balance public health, but also balance business interests, and balance, you're setting up a new arm of an economy, and so it has implications. There are, and we've got here key finding 6. There are accidental ingestions, and there are need for youth prevention programs, and there is a real need for the lockbox initiatives that OMA's implementing. And there's a need to make sure that we have prevention of the strong packaging and labeling and all of that just passed. So I think all of that is important from a public health perspective. But I think what we're lacking here in Oklahoma is really a real respect of the patients. We ask patients whether or not they think their government supports them. Let me pull out the exact number. Let's see. We asked, do you feel like OMA and the government supports you? And yep, they felt very, about half felt like they were supported by their government, and 39% of patients said that they would change their voting party depending on the governor's stance for medical marijuana.
Yeah. Yeah. So that's really awesome. And that's my sense of things, just having, basically done all this, from the grassroots up. That's definitely my sense of things. Well, we're a little bit, normally we do about 20 minutes, but this has been really good. And I'll likely have you back because you and I think, are going to be talking a lot in the near future about a whole bunch of stuff, but based on this conversation. But what do you want to do? I mean, what's your passion? Where do you see yourself, let's say, in the next couple of years? Is it in a agency? Is it doing what you're doing? Where do you see yourself?
Yeah, I would love to be in a regulatory agency, sitting in a public health position. Advancing cannabis research in an academic institution would also be great. And really trying to work towards integration of medical cannabis into mainstream healthcare. I come from mainstream healthcare background, from public health, implementing HIV into new settings. And so I'd love to work on medical cannabis into new settings. And part of that is educating healthcare providers and educating policymakers. And so either sitting in the regulatory would be great, or in an academic position or continued partnership with my nonprofit. What I'd like to do with this report locally is next week, I'm going to be visiting the State House, and we're going to be sharing this report with all of the policymakers here. That's already been shared with the governor, with OMA, with the AG's office. And so we're going to be continuing to, use this report and the key findings to share again with the state. And we have a big event next Thursday with Americans for Safe Access, Steph Sher, where it's going to be here in Oklahoma. We're also going to
Steph's going to be here?
Yeah, we hope you can come next Thursday. It'll be at Paseo Arts District, and we'll be live streaming it too. And we'll be discussing this report and what her thoughts are about the Oklahoma market. So we'd love to have you.
Yeah, no, I'll definitely be there because it's, so we're actually talking at a little higher level about some things, which is kind of cool. So it'd be nice to actually talk to her in person. We've talked over the phone. This is great. So this is really good. So I'll definitely be there on Thursday. But let's continue this dialogue. This is really good. First of all, it's great to know that you're in the state. You have some chops. Those chops help get things done and help move the needle, as you know. So giving you big hugs, virtually, love, and we'll meet. If you're here in Oklahoma City, you should come by the office sometime and we'll kind of have a dialogue. But anyway, we'll do all that offline. So thank you so much for being here. Is there anything that you want to kind of leave the podcast with?
Yeah, thank you so much for having me. I really appreciate it. You can see the website here. You can download the report, share the word. We're trying to balance the conversation here in Oklahoma, and not just rely on fear-mongering data at the state level. So thank you for having me, Chip.
Yeah, absolutely, Dr. McNabb. This has been great. So I'm very excited about you being here. So wonderful. Anyway, thank you guys for another great episode of Chip Talks Podcast. We'll be back soon with another episode. We'll see you guys. Bye.
Bye.
Thanks for joining us for another exciting episode of Chip Talks Health. I wanted to thank Dr. Marion McNabb for sharing her experience, research, and perspective on one of the most important conversations happening in healthcare today. Whether you're a patient, healthcare provider, policymaker, or simply someone interested in better understanding the future of health, conversations like this matter. As you've heard today, the future of cannabis, public health, and patient care won't be shaped by opinions alone. It will be shaped by research, education, transparency, and a willingness to follow the data. At Chip Talks Health, our mission is simple: bring together experts, innovators, practitioners, and thought leaders who are helping us ask better questions about health and wellness. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with someone who would benefit from the conversation. You can find the full episode transcript, companion blog article, and additional resources at chiptalkshealth.com. Until next time, remember, your body was designed to defend, repair, and heal when given the right tools and the right environment. I'm Chip Paul, and this has been Chip Talks Health. We'll see you on the next episode.